Hi, my name is Cameron. I'm a physician assistant student, and today the purpose of this exam is to perform a general survey, a skin, vitals, HEENT exam, and at this moment I will ask you to remove your shirt, shoes, and socks while I go wash my hands. So when I walked in, I was assessing general health, general appearance, general health status, as well as if the stated age correlates to the apparent age. I'm assessing grooming and hygiene, as well as noting any body odors or breath odors. I'm also assessing habitus and or any obvious physical deformities. And I'm also assessing motor activity, posture, facial expressions for any signs of pain or distress. I would perform a mental status exam at this time, and I will move on to vitals. I will do a vitals check now. I'm going to take your height and weight, and I'm also going to take your oral temperature with my thermometer. However, I don't have any cover slips, so I am going to have you just pretend to place this thermometer under your tongue. We'll wait for 1 minute or until it beeps, and at that time I'm going to have you switch the thermometer and I will check your pulse, your radial pulse. I am going to use my index and middle finger to assess the rate, rhythm, and amplitude of your palpable pulse, and I will count for 15 seconds and then multiply by 4. At the same time, I'm going to check the rhythm and depth of respirations. I am going to count for 15 seconds and then multiply by 4. Beep, beep, beep. Okay. Great, thank you. And now I am going to move on to blood pressure. I am going to measure the bladder of my cuff. I'm going to ensure that the width is 40% of the arm circumference and the length is about 80% of the arm circumference. Good. And I will just leave this here. I'm going to position the cuff. I'm going to palpate your brachial artery. Great, right there. And now I'm going to position the cuff 1 inch above your antecubital fossa. Sorry, you're okay. Sorry. It looks so good. Okay. Now I'm going to inflate to check, you can rest your arm up here. I'm going to inflate my cuff to check your systolic pressure. First, I need to make sure it's closed, and then it'll work better for me. Okay. Okay, great. And now I'm going to reinflate the cuff. And check for reinflate the cuff 30 millimeters of mercury above the level I just received, and I'm going to listen for the onset of corticoff sounds and determine the systolic blood pressure. Then I will deflate the cuff and listen for cessation of corticoff sounds and determine the diastolic blood pressure. Sorry.
No, you're good.
I'm also deflating 2 millimeters per second. Great, thank you. I will now continue to the opposite arm, seated, and record both readings in both supine and standing position if needed. Okay, you can relax your arm. Okay, thank you. And now I'll move on to the skin check. I am assessing your skin's pigmentation, discoloration, looking for areas of masses, rashes, and lesions. I'm also inspecting your face for edema, asymmetry, and I will have you stand up now, please. Okay, making sure there's no rashes, lesions, or masses. You can hold your arms out for me. Great, thank you. And I will have you lift up your shorts. Great, now turn around and lift up your shorts. Thank you. And now I will test for, oh, and I'll also have you grab the table so I can see the bottoms of your feet. Check for any ulcers there. Thank you. And I'm going to check for your fingernails for cyanosis, blisters, brittleness, lines, lesions, or clubbing. Okay, and your toes look good there. And then I will have you stay standing for just another second for me, please. And I'm going to check you for mobility, texture, and moisture, and also noting mobility and turgor. So I am checking temperature now, mobility and texture and moisture, mobility and turgor, temperature, texture and moisture, mobility and turgor, texture, or temperature, texture and moisture, mobility and turgor, temperature, texture, moisture, mobility and turgor. You can have a seat up here for me. And now I'm going to do a head, scalp, and skull exam. I'm going to inspect your skull for any contour, deformities, any lesions, masses, nodules. I'm also going to check its position, make sure it's symmetric, and check the size and the shape. I'm also going to inspect your scalp. I'm going to inspect changes in hair pattern, hair texture. I'm looking for nits, lice, lesions, dandruff, and looks good there. I'm gonna go to the other side, make sure there's nothing there. Nope, no nits, no lice, no dandruff or lesions or anything. Healthy scalp. Okay. Now I am going to inspect your face for any asymmetry, edema, hair growth, lesions. Thank you. And now I'm going to palpate your scalp or your skull for tenderness, contour, deformities, nodules. Good there. And then I'm going to palpate the scalp for mobility and tenderness. Good there. And now I'm going to move on, and I'm going to palpate the temporal arteries. Sorry, my getting raynoids in my toes. The temporal arteries for pulsations and tenderness. Everything good here. Okay, now I'm going to your TMJ. I'm going to have you open it for me. Move it side to side.
Sorry about that.
It's okay. I'm checking your parotid glands for tenderness and moisture. And the area around your mandible, it's okay, you can collect yourself. Area around your mandible for tenderness. I'm also going to check, palpate your forehead and your supraorbital ridge, your zygoma, and the area around your mandible again for any tenderness. I am now going to move on to the eye exam. I'm inspecting your eyebrows, eyelids, and eyelashes for any deformities. I'm checking their position, their shape, making sure they're asymmetric, checking for erythema and lesions. I am also inspecting your eyelids for position and closure, and I am inspecting your lacrimal apparatus for tenderness. I'll palpate for tenderness, but I'm checking for lesions, erythema, edema. I'm going to palpate for tenderness now as I attempt to express any discharge from your nasolacrimal duct. I'm now going to inspect your bulbar, your palpebrae, conjunctiva, and your sclera for any injection, redness, presence of blood, and lesions. I'm going to pull up on your eyelids and I'll have you look down for me. Good. And I'm going to pull down and have you look up. Good. Thank you. Sorry. Now I'm going to have you, I'm going to test your near visual acuity with Rosenbaum's chart. I will have you hold the chart out with your arm straight out ahead of you, and I will have you cover one eye and read the small sign you can see out loud for me.
4, 2, 8, 3, 6, 5.
Perfect. Now switch hands and cover the other eye and read the small sign you can see.
3, 7, 4, 3, 5, 8.
Perfect. And now uncover your eyes and read them with both eyes.
9, 3, 7, 8, 2, 6.
Perfect. Now I'm going to check the diameter and pupil size and check for symmetry, and they look good. Now I'm going to check visual fields with the fishbowl test. I want you to put your arms together for me with your hands up and then point, and when you see my fingers come into your view, please point at them. Okay. Great. Now I'm going to test with my pen light. I'm going to start with extraocular movements in the 6 cardinal directions of gaze. I'm going to start with the H test. I will have you look at my pen light and follow the tip of my pen light with your eyes, and please don't move your head so I can properly test these visuals, okay? And I'm going to pause at each extreme. It's okay. It can be funny sometimes. Great. Good job. And now I'm going to test for lid lag. Please follow the pen light with your eyes. I'm going to make sure your lids are symmetric. And then I'm going to test for accommodation and convergence. I will have you look at this point on the wall.
Okay.
And as the pen light comes into your view, go ahead and look at it.
Okay, yes.
See that point on the wall? Okay. Now I'm going to check for convergence. As the pen light is approaching you, please just follow it with your eyes the entire time, okay? Great. And now I'm going to check pupils. I'm going to test your pupillary light reflex, and I will also check for crescent shadowing, okay? Great. I'm going to check for direct and consensual constriction. I'm going to place my hand on the bridge of your nose, and first I'm going to check your left eye and for direct and consensual constriction. Now I'm going to check your right eye for direct and consensual constriction. Perfect. Now I'm going to do the ophthalmoscope test. I'm going to check first, I'm going to dim the lights. However, if we dim the lights in here, they will be completely off and I want to see. I'm going to check that my ophthalmoscope's light is working, and it is. And then I'm going to make sure it's at 0 and I can see. Perfect. And I'm going to first check for your corneal light reflex. I'm going to check your eyes now. Great. Perfect. And then I'm going to come over about 15 degrees and 15 inches away from you. For your left eye, I'm going to use my left hand, place it on my fundoscope. I'm going to place my hand on your head to have more control. Once I find the red reflex, I'm going to advance towards you, and I have found the red reflex, so I'm coming towards you. I am assessing the optic disc and its margins. I'm assessing I don't want this to go in your eye so much. I'm assessing the optic disc, its margins, the retinal veins and arteries. I am also assessing the condition of the retina, and I'm going to have you look at the light, and I've assessed the macular fovea, and now I'm going to repeat it on the other side. First, I'm going to switch to my right hand for your right eye. Place my left hand on your head, and once I've found the red reflex, I'm advancing. Go ahead and look at the light. Perfect. Thank you. Now I am moving on to the ear exam. So for the ear exam, I'm inspecting your auricles, both of them. I'm also making sure that there's no discharge, deformities, lesions, or swelling. I'm going to palpate your auricles, your tragus on each side, and the mastoid for tenderness. Perfect. And now I'm going to inspect your ears. I'm doing my otoscope test on your ears. First, I'm going to change my heads, and then I'm going to put on a clean speculum. Make sure the light is still working. Perfect. Clean speculum. And first, I'm going to pull up. I'm going to hold the otoscope correctly. I'm going to hold with my first 4 fingers, and then use my pinky as a fulcrum. I'm going to pull upwards and outwards on your ear so I can straighten the ear canal. I am inspecting the external canal. I am noting any lesions, deformities, looking for the tympanic membrane, and the amount of cecum or cicerum, and I have seen the tympanic membrane, and it's gray color. I'm noting the color and contour. It's pearly gray. And I'm also noted the tympanic membrane landmarks, which are the malleus, the umbo, and the cone of light. I'm going to perform the same thing on this ear. And perfect. Now I'm going to change the speculum, and I'm going to perform the nose exam. I'm going to inspect the nose for edema, deformities, any lesions, and then I'm going to palpate the nose for tenderness, and then I'm going to go back and do the whisper test on the ears. I will have you occlude both side or one side at a time. However, I'm going to say a 2-syllable word, and I want you to repeat it back to me. I'm going to stand 1 or 2 feet away this side. Go ahead and occlude your left ear. And we'll do the same for this side. Hockey. Perfect. And now I will go back to the nose exam. I have inspected and palpated your nose. Now I will do the nasal patency test. Go ahead and plug one nostril and sniff in. Perfect. And do the same for the other side. Great. Thank you. Now I will palpate the sinuses. First, I will palpate the frontal sinus for tenderness. And now the maxillary sinus for tenderness. And now I will move on and put a new speculum on my otoscope. Make sure the light is on. And I will go ahead and hold the otoscope in the same manner I did for the ear. And I'm going to have you tilt your head back for me. I'm going to pull up on your nasal tip. I am going to inspect the nostril. I'm going to inspect for any polyps, foreign bodies, and the nasal mucosa. I'm also inspecting the nasal septum on both sides for deviation and perforation. Great. Sorry if that was a bit uncomfortable. Now I am moving on to the oral exam. I am assessing, I'm going to assess the nasolabial folds, the lips, the oral mucosa. I'll go ahead and have you, well, first I'll put on my gloves, and then I will have you open your mouth so that I can assess the oral cavity. I'll assess your buccal mucosa, as well as your teeth, your gingiva, and the floor of your mouth. So go ahead and open your mouth for me. I'm going to use my pen light as the light. Okay, everything looks great. And I'm also going to look in your posterior pharynx and make sure I can see the condition of your tonsils. I'm also going to note the dentition in here, looks great. And I'm going to have you stick out your tongue and say ah. And I'm noting the rise of the palate and uvula. And now I'm going to hold, I'm going to have you stick out your tongue, and I'm going to make sure that it protrudes in that midline. I'm going to check its color and texture. I'm going to hold your tongue with a piece of gauze as I palpate both sides. Sorry, this is going to feel very weird. I'm palpating both sides and checking for any nodules. Oh, sorry, some of the gauze came off. Okay. And now I'm going to check your anterior neck. I'm going to check for your thyroid and make sure, first I'm going to check that your trachea is in line. I'm inspecting your thyroid for any thyromaglia, jugular venous distension, any nodules, any masses, any lesions or edema. Okay, right there. Your isthmus is here. Now I'm gonna have you swing your legs over, and I'm going to displace your trachea and palpate each thyroid lobe. First, I'm going to place my hands on your clavicle, and then find your trachea. So when I displace, I'm going to say swallow. I'll have you swallow, and then I'll palpate. Okay, displace, swallow, palpate, and then the other side, swallow. Great, and then go ahead and swallow. Great. Now you can swing your legs back over, and I'm going to complete each lymph node. First, I will start with the preauricular lymph nodes, then the postauricular lymph nodes, the occipital lymph nodes, the tonsillar lymph nodes, the submandibular lymph nodes, submental lymph nodes, superficial cervical chain, anterior cervical chain, posterior cervical chain, superficial lymph nodes, and then I'll have you tilt your head to one side. Deep cervical lymph nodes and deep cervical lymph nodes. Thank you. And I'll have you take a deep breath in, and I'm palpating the supraclavicular lymph nodes. Thank you for watching this exam.